Welcome to Kathryn Raaker's World. Innovation, culture, adventure, fashion and health, artists, destinations, traditions. This is Kathryn Raaker's World.
Hi, this is Kathryn Raaker of Kathryn Raaker's World, and Let's Just Talk. You know, avoiding the coronavirus is top of the mind for most of us, but it's especially critical for organ transplant recipients. You know, they're at a higher risk because they take immunosuppression drugs that keep their body from rejecting their transplant, but a side effect is a weakened immune system. That's where telemedicine and other advances in home-based care can help patients and their caregivers stay healthy during the pandemic. And now, with more, is leading transplant surgeon Dr. Adam Bingaman from Methodist Hospital, along with Peter Maag, CEO of transplant-focused company CAREDX. I want to welcome you to my show, doctors, and I want to tell you that I want to thank you so much. My brother and few others were transplant recipients. I can't thank you enough for helping them and others.
Good morning.
Good morning, and a big shout out to all transplant patients and their caregivers.
Doctor, what are some of the risks associated with organ transplants during COVID?
Right. Well, like you said, organ transplants are wonderful because they really do give the gift of life to patients. But because they are immune suppressed, they are a vulnerable population. And so this is a group of folks, as you know, that really needs to be very cautious out in the public, wearing masks, socially distancing, frequent hand washing. But importantly, our patients do have to keep up with their medical care. They need to continue to see their transplant centers. If they can do it via telehealth visits over the computer or their phone, then that would be a great option for them. They need to keep up with their blood drawing. So keeping up with their health is an important factor during this time.
Doctor, what's most important for patients to know?
For sure. I think that patients, we want them to have a normal life. We want them to be visiting, of course, with family, with the holidays coming up. But do not underestimate this virus, the cold and the flu season. It's a very difficult time. So our goal really is for patients to live normal lives, but you've got to stay vigilant and stay safe. But don't skip your doctor visits.
You know, doctor, most doctor's offices and hospitals are very safe today and are really ready for you when you come in.
Yes, absolutely. And I'll tell you, everybody's using telehealth. Sometimes patients are afraid. They think, I don't really understand technology, but it's very, very simple, right? And so it can be done with a phone. It can be done with a computer at home.
Right.
If you have a caregiver, ask for help. But sometimes patients, they think, oh, this is complicated, but it's really not. It's set up for you.
You know, doctor, it's so easy to do telehealth. I did it through my COVID-19, and it was so simple with my doctor. It just really reassured me.
Yes, that's exactly right.
That would be the key thing, I would think, right?
You should have a partner. Caregivers are so important during this time, and so
right,
make
that's
certain.
that's for sure, doctor.
Yes.
Absolutely.
Yes.
Now, Peter, can I ask you, welcome to our show, but how are you?
I'm doing great.
Can you tell us what technology and home health options do patients have?
Think of the power of combining the telemedicine together with blood draws that are done from the convenience place of your home. So we offer home-based phlebotomy, basically meaning that you can have all your lab work done from the convenient place of your home. And we also have developed AlloCare, an app that allows you to monitor the health of the organ with a simple iPhone application. So these new technologies are supporting telemedicine, but make sure that the caregivers and the professional health teams get the information back at the transplant center or at the practice, making sure that you continue to be able to monitor the health of the organ.
Doctor, what should transplant patients expect as they recover? And they are really protected at home, correct?
Yeah, that's right. I think that what we want is for patients to live a normal life after a transplant. It's such a gift, but they've got to keep in mind that they've got to continue to keep up with their health visits. You know, many of our patients, of course, have other issues like diabetes, like high blood pressure, like heart disease. And so making certain that you are partnering with your doctors, thinking about the flu shot, you know, these sorts of things, making certain that the caregivers are staying safe and they're getting their flu shots. So all of these sorts of things are very important to keep in mind, especially as the holidays approach.
Especially when the transplant patients are at home, the caregivers need to monitor their temperatures and their vital signs so that they keep them safe, doctor. And now I'd like to ask Peter, what is the key for caregivers to be aware of?
Well, continue to make sure that you monitor the health of the organ. You know, transplantation is such an incredible gift. Make sure that we continue to care for the gift. And with our AlloCare and RemoTrack option, you can do that from the place of your home. So if you need more information, CAREDX RemoTrack or CAREDX AlloCare, and just stay informed at these very special times.
I want to thank you both for your mission and for doing the work that you do on transplants. And we will be right back after these important messages on Let's Just Talk and Kathryn Raaker's World. Hi, this is Kathryn Raaker of Let's Just Talk Radio and Kathryn Raaker's World TV. You know, among the troubling consequences of COVID-19 has been a sharp decline in doctor's visits and vital screening. Joining us with some tips on getting back to the doctor safely is the Chief Medical Officer, Head of Technology and Performance at United Healthcare, Medicare, and Retirement. His name is Dr. Saurabha Bhatnagar. Welcome to our show, Doctor, and how are you today?
I'm doing very well. Thank you so much, Kathryn, for having me.
You know, I work with a lot of doctors, and this is so important to get into your doctor as safely as you can, and they're doing a lot of things. So we know doctor visits have been down during the pandemic. What did that decline look like, and are you finding people still hesitant to go to the doctor?
What people may not realize is that the decline was fairly significant. So the Centers for Disease Control just last month released a report that 4 out of 10 Americans avoided or did not go to doctor's offices. And it wasn't just for emergency care, it was for routine or preventative care, things such as colon cancer screenings or mammography for breast cancer screenings or an annual wellness visit. We've seen that significant decline. And if you looked at earlier in the COVID-19 pandemic back in April, only about 35% of folks were comfortable going into the doctor's office. Now, though, that number has increased to 70%. So people are more comfortable. And so what we really want to encourage, and what I want to encourage as a physician, is getting people to be safe and comfortable and going back to those doctor's visits, and especially those preventative exams, those annual wellness exams, those things that are so important, not just for urgent and emergent care, but also for prevention and staying healthy in the future.
You know, and I also had COVID-19, and I'm a little older, right? But guess what? We did a lot of different things before I went into the doctors again. And I mean, I feel really good about going to see my doctor, but what are some of the consequences of delaying medical care, especially for older adults?
The consequences of delaying medical care, especially preventative, is staggering. So we just talked about colon cancer screenings and breast cancer screenings. There's a study that was just recently released from the National Cancer Institute that said that just because of the preventative care gap that we've seen over the last several months, so those folks that have not gone in to see their clinicians, that there will be an increase in about 10,000 deaths over the next decade. That could have all been either prevented or diagnoses could have been made earlier had folks just gone in to see those doctor's visits. So while I completely understand folks feeling a little bit nervous in the early days of the COVID-19 pandemic, now doctors' offices are prepared, hospitals are prepared, and just a lot of the similar things that you're seeing when you go to the grocery store, those little stickers on the floor that keep you 6 feet apart, that same type of social distancing and prevention, those are the same type of precautions, even more so, that doctors' offices and clinics are using across the United States to make sure that your visit when you go back to see your doctor is a safe and secure one.
Well, I have to tell you, I just went to my eye doctor yesterday, right? And you don't even get in the door without them doing your hands, doing your temperature, the whole 9 yards, and everything is really, it's so clean, it's so unbelievable. I really felt safe, and I think, people shouldn't worry about it, because you guys have really done an effective job. Do you have any tips to help people get back to the doctor safely and effectively? And I know there's telemedicine as well, right?
Yeah, absolutely. And what you're talking about right there, there's a few great tips that I think folks are just much more used to doing now, just because of COVID-19, that they were used to doing earlier in the year. So wearing a face mask, hand hygiene, so washing your hands, using hand sanitizer, keeping that social distancing, and exactly what you mentioned, arriving at your appointment on time, making sure that you have a scheduled appointment, your doctor's office is ready to see you, because what's gone is the days of last year where you'd have a cramped waiting room and chairs stacked next to each other. That no longer exists in doctors' offices these days. And so the waiting room is fairly sparse. They don't want to keep people waiting next to each other in small, close quarters. So you'll see chairs that are much more distance. It's much safer environment. So you can do those types of things. Other things that many of our seniors enjoy doing when they go back to see their doctor's office is going to during an alternate time. So middle of the week or early in the morning, when they know the doctor's office is less packed. Sometimes it's easier to go in to be able to see your clinician during that period of time. And as you just mentioned, telehealth visits, what we've seen even amongst our senior population, those who are 65 and over, last year in 2019, only about 0.1% of seniors used telehealth care at United Healthcare. This year, we've seen that number skyrocket to 40% of our members are taking advantage of our amazing and easy to use telehealth services to be able to go see their doctor, go do an annual visit, maybe adjust blood pressure medications. And telehealth, while it's not good for anything that requires a hands-on physical exam or anything that's emergent care, it's good for a lot of other preventative care and annual evaluations. And then lastly, I'd recommend, if folks are at least a member of United Healthcare Medicare plans, we also have in-home services. So your insurance company may offer this as well, which is we can bring a clinician with personal protective equipment, face mask, social distancing into the comfort of your own home so that you can at least do an annual exam, annual wellness visit.
And that's really so important, doctor. I mean, telehealth was really wonderful because I got COVID-19 on the middle of March last year. And that was the first thing.
Yeah.
That was the first thing. Well, I'm in very good health, like what a lot of other people. I had a light case of it. So, it was great. My doctor was on the other phone. I've used telehealth since you guys started a long time ago using it. And I think it's brilliant. And it also, if you have a caregiver there or you have someone like your daughter, son, or whatever, they can hear you talking. They can make sure that the doctor's okay with you being there in the room with that person. And it makes it a lot better because if they need to take notes or need to whatever, they can do that. Am I right about that?
You're absolutely right. And first of all, I'm glad you're healthy and safe and well recovered. Absolutely. One of the things that telehealth also offers an advantage is if you're a caregiver for a family member or a loved one, is that you can sometimes even do two-way telehealth visits where you don't even have to be in the same location. So you have your daughter or son or family member caregiver in one location. You have you as the patient or the member in another location, and then you have a doctor in the third location. You can at least have that caregiver support if you need it via telehealth visit, just as you would in a face-to-face visit. All of those conveniences are still available.
Right, and that's so very important today. I know that our daughter, right, who lives in a different area, my husband had to go to his doctor's visit, right, and he taped it on his telephone for her because, we couldn't do telehealth at that point. So it just made everybody feel much better about what was going on, so we knew what the details were. So that was another way to do it. So where can we go for more information, Doctor? And I want to thank you for your mission. I think it would be really nice, and I'm going to suggest this to you, that you do a PSA in a doctor's office to show people on television or whatever what it's like to go into a doctor's office. What do you think about that?
That is a great idea. And folks can go to uhcmedicarehealthplans.com to find out more information about how to stay safe, what doctors' offices are doing, how to seek medical care at the right time. And really, at this time of the year, what I'm really encouraging folks to do as a physician myself is be healthy. We still have COVID-19. We are coming up on the flu season, so I encourage folks to schedule their flu vaccine. I'd recommend with flu vaccines, it's no longer just walk-in. You want to schedule it ahead of time just so that there's not a wait when you go there. So this time of the year, the flu vaccine is critically important. And as you're thinking about what health plans or what health services I need next year, just thinking about how to stay healthy as we end 2020 and really start 2021 in a happy and healthy mindset for you, yourself, and your loved ones.
I can't thank you enough for your mission, Doctor, and what you do. This is really wonderful, exciting news for not only seniors, but people that are maybe even a little younger than seniors, right? Yeah, don't be afraid to go to the doctor. Don't be afraid to do telehealth. It's really simple, Doctor, right?
Absolutely. It's very easy to do. And thank you so much for having me today. I've really appreciated our conversation. And I really appreciate you getting this message out there to encourage folks to go seek that preventative care and stay healthy into 2021.
Give that website one more time, Doctor, if you don't mind.
It's uhcmedicarehealthplans.com.
And thank you so much. And we'll be right back after these important messages on Kathryn Raaker's Let's Just Talk and Kathryn Raaker's World. Hi, this is Kathryn Raaker of Kathryn Raaker's World. I have a wonderful guest that's an expert in everything from healthcare to whatever, anything that you need to know about the military. He's the founder of Veterans in Defense of Liberty, a 501c3. That is an advocacy group. Dr. William Scott Magill, like I said, is the founder and executive director of Veterans in Defense of Liberty. He served in the United States Marine Corps, with the United States Army Medical Corps, and with the Denver Police Department. He holds a Bachelor of Business Administration, a Master's of Healthcare Administration, and served as the Chief of OBGYN at Irwin Army Hospital in Fort Riley, Kansas, until practicing as an obstetrician and gynecologist in Springfield, Missouri for 21 years, which was his own practice, before founding Veterans in Defense of Liberty. Dr. Magill is the recipient of the Let's Just Talk Radio Award for Best Veterans Project, the Missouri GOP Milton Friedman Award, and the Daughters of the American Revolution Distinguished Citizens Medal. We want to welcome you to our show today. Dr. Magill, how are you?
I'm well. It's a pleasure to be here, Kathryn. Thank you.
We have talked over this pandemic, and I had it, as you know, about what we could take to either prevent it or to help people that had it. And I really think that we need to say what COVID-19 is to start, why certain therapies are better than others, and why you're worried about this upcoming vaccine. Tell us that, if you don't mind. This is the discussion today. Go ahead.
Well, it's a pleasure to be here, and it's a pleasure to talk about it. I am concerned because I do not understand why there is such a push for a vaccine. In reality, if you have a cure, you do not need a vaccine. I would argue that we actually have not only a cure today, but a medication which functions like a vaccine. And that's hydroxychloroquine, which has been discussed and debated and poo-pooed by the national media forever. But in reality, Dr. Fauci is known for the last 15 years, and he's written about hydroxychloroquine, and he knew full well that nobody needed to die from SARS-CoV-2. The National Institute of Health, which is the organization he heads, back in 2005 studied chloroquine, which is a more powerful drug than hydroxychloroquine, but every bit as safe as like I said, even Tylenol has more complications. And why he has his counterpart in France was quoted as saying that the game is over when it came to hydroxychloroquine and what we call coronavirus or SARS-CoV-2. SARS-CoV was initially came out was a coronavirus which caused SARS. Hydroxychloroquine worked against it. It works against SARS-CoV-2 just as well. There are not anecdotal studies. Fauci talked about anecdotal studies. Those are studies that advertising agencies use. That is not what is done in healthcare. And there are numerous cases out there of physicians that have treated with hydroxychloroquine 500 patients with no deaths, no hospitalizations, no intubation, and it is being kept from the public. I would dare say that, and Dr. Fauci knows full well. So we have an awful lot of deaths in America that could have been prevented had physicians not been frightened, had the patients not been frightened of using hydroxychloroquine as a treatment. In reality,
when should they have used it or use it? Before people go in the hospital?
Well, there was, absolutely. At the first sign of any symptoms, be that just loss of taste, you should be put on it. And it is a cure 98% of the time. But beyond that, it serves as a prophylactic, a medication to take to prevent contacting it most effectively. Personally, I'm on it. I know that the coronavirus is a weaponized virus being used against us particularly for the upcoming election, particularly to take over the United States. But that's a topic for a whole nother.
And the other thing, Doctor, our president took it.
No, our president
probably is still taking it. We don't know that for sure, but I mean, I think that the fake media has put so much out there against this drug that has scared so many people. They were afraid to take it. I took it, but I couldn't take the other part where they wanted to give me something else on top of it.
As if
yeah, right. So the thing is that most people don't even know they have COVID-19. And when they started testing every single person, did you find everybody seemed to have it, but they had antibodies to it. Am I correct?
That's correct.
The other thing that I thought was funny, Doctor, was that, a lot of people said, oh, you need to quarantine yourself from your husband and everybody else in your family. Well, guess what? I didn't. I don't mind admitting it. And guess what? He was more at risk than I was to get COVID-19, and he got the antibody. He only had one day that he thought maybe he had it, right?
Right.
But because of the medications that he was on, which he's on a lot, it must have helped prevent him from getting it, a full case of it. I want to thank you so much for joining me today, Doctor. You are always thrilling guests to have on. And I see your wonderful library back there. And it's, you know, Semper Fi. You know, I used to be a Marine wife, but then I became an Air Force wife. And then, you know, being with the military for 41 years with one of the best companies in America. We won't mention that though. And we're still working. So I think that our generation and younger generations that really appreciate work, you know, really care about our country. I'm seeing more and more Americans standing up, and I'm so proud to be an American. So thank you so much for your service. Keep up the good work. You're going to be putting on a program that I'm working with you on, that we're going to move forward on. And we also have an associate members for the Champions of Liberty, correct?
Absolutely. As well as Veterans in Defense of Liberty.
Right. So where do they go, Doctor?
Because for one big reason, and that is freedom is a family affair.
That's right. So give your website, because we have to say goodbye.
VIDOLamerica.org. God bless and goodbye.
And thank you so much for joining us today on Kathryn Raaker's World. Join us every week for our program. And see you soon. Don't forget to go to our website at KathrynRaakersWorld.com. Watch us on loads of television stations all across the country. And we just joined Simul TV. Watch us there as well. See you soon.